Well, good to have you with us here on the South African Morning. A new study has found that advanced cancer patients are at higher risk for depression. Let's try and find out how we can help and how we can try and avoid this, if there is a way, joined by Dr. Renee Krauser, UCT's acting head for Interdisciplinary Palliative Care. Doctor, good morning to you. And I'll be honest, and not to be insensitive, I wouldn't have found it all that surprising that those with advanced cancer could be suffering from depression at some point. But I was very surprised to see the number of cancer patients that struggle with depression. Good morning. How surprised were you?
I agree with you, Gareth. We were definitely not surprised. We were also not surprised to find out so many patients had pain as well. It was sort of on the same level as international studies, but really on the higher bandwidth, especially around pain control and pain. But what it did do, it brought it to the forefront in South Africa, this study, so that we could actively now manage this and not sort of say it's not something that is real in our country. So that was probably the biggest advantage of doing this study. It was putting a number to it and making sure everybody understands that this is a real issue and this issue needs to be addressed.
No, it certainly does. And when you start putting numbers to sensitive issues like this, it has a target, it has an aim, it has a goal that we can work towards. So what's the hope for this kind of data? Doctor, what do we start doing to try and bring that number down, provide this holistic care to advanced cancer patients?
Thank you. It's definitely to try and integrate palliative care into all across the healthcare sector in South Africa. And we have actively done this together with the oncology services across South Africa in the public services, trying to integrate palliative care. The oncology registrars, or the training students, as you will know them, are now participating in a course to train them in pain control and palliative care, so that they realize that this is a very important component of the care that they provide to patients. And this has not only been done in oncology, but also in family medicine. And we hope that it will be done in other disciplines as well, in all disciplines, especially dealing with cancer. But we also have to realize that this burden is not just for cancer patients, but also other patients with chronic illnesses who are suffering. So it is all patients with serious health-related illnesses actually require a palliative care approach.
I just gotten a tweet from someone on our Twitter account at eNCA, Doctor. Maybe you can help me and them understand. They're asking a question around advanced cancer patients on chemotherapy, obviously, to treat the cancer. What would the effect be of palliative care or antidepressants and medication? How would that interfere with something like chemo? Would that counteract each other? How dangerous is that?
No, definitely not. Palliative care can be provided alongside patients receiving chemo and radiotherapy. It is actually recommended. It's not all or nothing. And patients shouldn't just go on to antidepressants, so they should be evaluated for depression. But definitely, and when we talk about palliative care, it's not just a medication that is provided, but it's an approach. It's how we look after patients so that they can receive comprehensive care. You know, it's the social factors that need to be addressed. It's the psychological factors. It's the pain, and sometimes even spiritual issues that need to be addressed. And this can only be done as a team and in close collaboration with the oncologist, so that the patient can receive comprehensive care.
Doctor, I'll leave this as my last question to you. Perhaps someone is watching now, a loved one, a family member, a friend of someone who does have advanced cancer. Obviously, emotionally, it's difficult at the best of times. How do we start defining and start differentiating between someone who's just having a tough time with cancer and someone who's at risk of depression? How easy is it to tell the difference?
Well, there are different clinical ways that we do. I mean, we have scales, we've got specific questions that we need to ask. But I do think all patients with advanced cancer should be in receiving palliative care approach, so that, you know, that they can be supported and prevented from developing severe depression. Because it is serious illness affects not only the patient, it affects the family, and everybody needs that extra layer of support. So it is acknowledging, and I think this is what the study did, acknowledging the fact that it has a huge impact on patients and their families, and it needs to be addressed as a system and not just as treating a cancer or a tumor. It is a person that is sitting there in receiving chemotherapy, and that person is made up of different components and needs to be treated looking at all those components.
I really appreciate it. You've broken it down beautifully for us. Renee Krauser, UCT Acting Head for Interdisciplinary Palliative Care.